Hi, my name is Tamar Zwick, and my topic for the speech is universalized healthcare. Every day, thousands of Americans go to the emergency room to seek healthcare because they cannot go to a regular doctor. This is either because the doctor will not accept them because they don't have health insurance, or because they cannot afford to pay the fee that the doctor would charge to them. People without health insurance often wait a lot longer than people with health insurance before they seek medical care. This causes them to become more sick by the time they finally get medical care, which makes it take a lot more time for them to get better. Now, for people without adequate medical insurance, one accident or illness can put them millions of dollars in debt. In fact, a one-night stay in a hospital room can sometimes cost an upward of $100,000. In America every year, a lack of health insurance causes around 27,000 preventable deaths. This is a huge amount for a country which is supposedly as wealthy as ours. So, what is universalized healthcare? Well, universalized healthcare is when health insurance, and therefore healthcare, is available to every resident and sometimes even permanent residents of a country. So, which countries have universalized healthcare? Almost every European country has universalized healthcare system. In fact, the United States is the only wealthy industrialized nation that does not have some form of universalized healthcare. Now, some people may believe that everybody in America has access to some form of health insurance. This is not true. Nearly 50 million Americans do not have any healthcare insurance. Many of these people are people who slip through the cracks. They don't qualify for Medicaid or Medicare because they earn too much. However, their jobs do not provide health insurance, and they cannot afford to pay for health insurance out of the money that they earn. In a survey done by the World Health Organization, the United States ranks 37 out of 190 countries in terms of our healthcare system. This is below all European countries and even below countries such as Chile and Costa Rica. On rankings of performance level of healthcare, the United States does even worse. There, we rank 72 out of 190 countries. This is deplorable for a country that is supposedly as wealthy as ours. Some people argue that universalized healthcare would make it harder to get access to adequate care than we have now. This is not true. The satisfaction level with the U.S. healthcare system is the lowest of any industrialized nation. That means that other nations such as Canada or Great Britain have more satisfaction in their universalized healthcare system than the United States does have in our healthcare system. So, why do we need universalized healthcare? Around 30% of Americans have problems accessing healthcare due to payment problems or lack of access to care. This is far more than people in any other industrialized country. About 17% of our population does not have any form of health insurance. This is a huge percentage. About 75% of Americans, either without health insurance or without adequate health insurance, have trouble paying for or accessing health care. So, why don't we have universalized health care in America? Well, some people argue that in order to have universalized health care here in America, we would need to greatly raise our taxes, which would hurt our already hurting economy. However, this is not true. Americans already pay a huge amount for their health care, whether through their jobs or out of pocket for independent health care. Therefore, if we increased the taxes to pay for a universalized health care system, it would not be felt because we would then not need to pay for our own health insurance, whether through our job or out of pocket. Universalized health care in America would provide health insurance and therefore access to health care to every single American. In this great country we call home, shouldn't health care be considered a basic right and not a privilege of the wealthy?